In this electronic lab, we will be talking about the muscles of the anterior and lateral compartments of the leg. The leg is divided into three compartments by septa: anterior compartment, lateral compartment, and posterior compartment. These compartments are related to the surfaces of fibula. درسنا إنه الفيبولا it has anterior, lateral, and posterior surfaces. The action of the anterior group is dorsiflexion of the foot. Dorsiflexion means lifting your foot up, and extension of the toes. The action of the posterior compartment is plantar flexion and flexion of the toes. Plantar flexion is standing on your toes. And the action of the lateral group is eversion of the foot. Eversion means lifting the lateral part of the foot up. Now, any muscle got tibialis in its name inverts the foot, and any muscle got fibularis in its name everts the foot. The sciatic nerve divides into tibial and common fibular nerves to supply the muscles of the leg and the foot. Here is the tibial nerve, which supplies the posterior compartment, and here is the common fibular nerve, which winds, as you can see here, around the neck of the fibula, and it divides into two branches, one deep, the deep fibular, and one superficial branch, the superficial fibular nerve. The superficial fibular nerve supplies the muscles of the lateral compartment of the leg, and the deep fibular supplies the muscles of the anterior compartment of the leg. Starting with the muscles of the anterior compartment, the most median muscle is tibialis anterior. Lateral to it, extensor digitorum longus, then extensor hallucis longus. To view this muscle, we have to remove the digitorum. Here is the extensor hallucis longus. As you can see, it goes to the big toe, and the most lateral one and the smallest one is fibularis tertius. The tibia has three surfaces: medial, lateral, and posterior surfaces. As you can see, the medial surface has no muscle attachments, it's subcutaneous, and it forms the shin of the leg. Tibialis anterior, again it takes origin from the lateral surface of tibia, and here from the lateral condyle of tibia. From the interosseous membrane, it passes from lateral to medial to insert into here, into the base of the first metatarsal bone and the medial cuneiform bone. The action of this muscle is dorsiflexion, and also it inverts the foot. Here is the surface anatomy of tibialis anterior, and this is the action: dorsiflexion and inversion of the foot. Extensor hallucis longus takes origin from the fibula. It passes here below the superior and the inferior extensor retinacula to be inserted into the base of the distal phalanx of the big toe. The action is extension of the big toe, and also as it passes in front of the ankle joint, it helps in the dorsiflexion of the foot. Extensor digitorum longus takes origin from the fibula. Also, it extends here to be attached to the lateral condyle of tibia. It passes below the superior and the inferior extensor retinacula to be inserted into the extensor expansion of the lateral foretoes. Here. This is the extensor expansion, which is attached to the base of the middle and the distal phalanges. The action of this muscle is extension of the toes, and again, as it passes in front of the ankle joint, it dorsiflexes the foot at the ankle joint. The surface anatomy for the extensor digitorum longus, and here is the action: extension of the toes and dorsiflexion of the ankle joint. The action of extensor hallucis longus, extension of the big toe and dorsiflexion of the foot at the ankle joint. Again, fibularis tertius is considered part of the extensor digitorum longus, Again, it passes below the superior and the inferior extensor retinacula to be inserted into the fifth metatarsal bone. Now, to summarize the insertion of the muscles in the anterior compartment, extensor hallucis longus is inserted here into the base of the distal phalanx. The extensor digitorum longus is inserted into the extensor expansion of the lateral foretoes, while extensor expansion is attached to the bases of the middle and the distal phalanges. Then we have medial muscle and lateral muscle, and these two muscles are attached to the metatarsal bones. The medial one is tibialis anterior, attached to the first metatarsal bone, also medial cuneiform bone. The fibularis tertius is attached to the fifth metatarsal bone. The blood supply of the anterior compartment is from anterior tibial artery. This is popliteal artery in the popliteal fossa, divides into anterior tibial and posterior tibial arteries. The posterior tibial artery descends to supply the posterior compartment, while the anterior tibial artery passes through this opening in the interosseous membrane to enter the anterior compartment of the leg. To view the artery, we remove the muscles. As you can see here, it passes through this opening in the interosseous membrane. It descends here on the interosseous membrane, and then it passes behind the superior and the inferior extensor retinacula. Then it continues as dorsalis pedis artery. Here is the dorsalis pedis artery. And the pulse of dorsalis pedis artery can be felt here over the tarsal bones between extensor hallucis longus tendon and the extensor digitorum of the second toe. Here is extensor hallucis longus, and this is extensor digitorum. Dorsalis pedis is located between these two tendons. The structures passing below extensor retinacula خلينا نشيلها أول. Here from medial to lateral, tibialis anterior, extensor hallucis longus, then anterior tibial artery and vein, and the deep fibular nerve, extensor digitorum, and the most lateral is fibularis tertius. The muscles of the lateral compartment are only two muscles, the fibularis longus and deep to it fibularis brevis. These two muscles take origin from the lateral surface of fibula. Then their tendons here pass below the superior and the inferior fibular retinacula to be inserted into the bones of the foot. Fibularis brevis is inserted here into the fifth metatarsal bone, and the fibularis longus, it has a link tendon, and it's inserted here into the base of the first metatarsal bone, and this medial bone, the medial cuneiform bone. So to summarize their insertion, fibularis brevis is inserted here into the base of the fifth metatarsal, while the fibularis longus is inserted into the first metatarsal and the medial cuneiform. The fibularis longus passes here on the plantar surface of the foot to reach these two medial bones. The action of these two muscles is eversion of the foot, so the plantar surface of the foot is facing laterally. Also, they help in plantar flexion of the ankle joint. Common fibular nerve, this is the superficial branch which supplies the muscles of the lateral compartment, and then here it becomes cutaneous to supply the dorsal aspect, the skin of the dorsal aspect of the foot, except the cleft between the first and the second toes for the deep fibular nerve. Surface anatomy of fibularis longus or peroneus longus. The action is eversion of the foot. It also assists in the plantar flexion of the foot at the ankle joint. It should be noted here that the eversion and inversion movements take place at the subtarsal joint, not the ankle joint. Fibularis brevis, again eversion of the foot. The blood supply of the lateral compartment is from fibular artery. This artery is a branch from posterior tibial artery. It stays in the posterior compartment and it sends perforating branches to supply the lateral compartment of the leg. Superficial dissection of the right lower leg and the dorsum of the foot. Superior extensor retinaculum, inferior extensor retinaculum, from medial to lateral, tibialis anterior, extensor hallucis longus, extensor digitorum longus, and here dorsalis pedis located between two tendons of extensor hallucis longus and the tendon of extensor digitorum longus of the second toe. Here is the branches of the superficial fibular nerve, here and here. These cutaneous branches supply the dorsum of the foot except the cleft between the big toe and the second toe. This area is supplied by the deep fibular nerve. Behind the lateral malleolus, we have superficial vein and cutaneous nerve. The superficial vein is the short saphenous vein. The superficial nerve is the sural nerve, which supplies the skin on the lateral aspect of the foot. Medial view, medial malleolus, and in front of medial malleolus we have superficial vein and cutaneous nerve. The superficial vein is the great saphenous vein and the saphenous nerve, which is branched from femoral nerve and supplies here the skin on the medial aspect of the foot up to the ball of the big toe, this area. Lateral view of the foot, superior extensor retinaculum, inferior extensor retinaculum, and here is the extensor digitorum longus acting on the lateral foretoes. Lateral to it, fibularis tertius, the distal end of fibula. This is lateral malleolus, which is subcutaneous at the lateral aspect of the ankle. And even this area, the triangular area, the most distal area of fibula, is also subcutaneous. And as you can see, it has no muscle attachment. The muscles of the lateral compartment, fibularis longus, fibularis brevis, they pass below the superior and the inferior fibular retinacula. The superior fibular retinacula is attached to the lateral surface of calcaneus and attached to the lateral surface of malleolus. The two slabs of the inferior fibular retinaculum are attached to the lateral surface of calcaneus. Here is the branches of the superficial fibular nerve. بعد ما يعطي lateral compartment, it becomes cutaneous and it supplies the skin over dorsal aspect of the foot ما عدا منطقة السkin between the first and the second toes. The deep fibular nerve بيغذي المسلس في anterior compartment, then it passes behind the superior and the inferior extensor retinacula to enter the dorsum of the foot. Here it terminates by supplying the skin between the first and the second toes. بينما superficial branch بيعطي lateral compartment, then it becomes cutaneous يعني بيخترق الديب fascia وبيصير superficial. It divides into these two branches to supply the skin on the dorsum of the foot except this area اللي بيعطيها الديب fibula.